Hi, I'm Jeremy. I'm one of the critical care paramedics on Cornwall Ambulance.
And I'm Martin, one of the other critical care paramedics here in Cornwall.
We'd just like to talk to you today real quickly about some important things regarding CPR. Not necessarily a demonstration for you, but just things that you need to understand should you ever find yourself in a position where you come across someone that needs CPR. One of the first things we need to look at is whether the person's breathing or no, or breathing normally. So what we need to do is actually get down and actually see whether someone's airway is open. So we tilt their head back and have a look in, make sure their airway is okay, and see if they're breathing. If they're not breathing, that's all we need to do. We then need to get on and do some resuscitation, get on and do some CPR, don't we?
We do. And one of the important things to do very, very early on is to call for help. Call 999. In out of hospital cardiac arrest, one of the most important things is chest compressions and getting a defibrillator. And there's community access defibrillators all over the place now. And by ringing 999, they can direct you to the nearest one, unlock it, and you'll be able to use it on the patient you're with.
Quite often when someone's heart stops, it doesn't necessarily just stop, it keeps on shaking a little bit, and we call that fibrillation. And that's what the defibrillator will do. That'll hopefully get that person's heart out of the fibrillation and defibrillate it back into a normal rhythm. For you guys, you just need to focus on doing good compressions. How do we do that?
So what we do is ideally we want to expose the chest if possible, especially if we've got a defibrillator to hand, because the pads are going to need to go onto the chest. But for the compressions initially, we need to identify where the sternum is. So that's the bony section in the middle of the chest. We need to put the heel of our hand against it, our other hand on top. You need to lock your arms out and apply about a third of depth of pressure to the chest wall, like that. The rate needs to be about 100 to 120 per minute, and you have to continue to do that until the ambulance arrives. It is tiring, and you are going to need multiple people to make sure you can do the most effective compressions for as long as possible.
And then when hopefully when a defibrillator arrives, someone will put a defibrillator on the top part of the right hand side of the chest, and on the left hand side is where it needs to go, and that conduction, that electricity will actually be able to go straight through the heart when they do it that way. And as Martin says, you've got these community defibrillators now that will do that for you, and it's very, very easy to use. Don't be frightened about it. Sometimes these things can be a bit scary if you've not done it before. Turn the machine on right away and it'll tell you exactly what to do, when to do it. It's very important you do this if someone needs it. It really is a life-saving thing, and we see it on a fairly regular basis where someone actually has their life saved by someone's coming across. So it doesn't matter when we turn up, you need the person there to start to give them the chance. Hope you never come across it. If you do, give me some pointers. Take a course, learn how to do it properly. Thanks very much for listening. We're Martin and Jeremy from Cornwall Ambulance.